Good afternoon and welcome to The Appeal Live, a co-production of Now This and The Appeal. I'm Emily Gal. In 2019, police in Walnut Creek, California, shot and killed Miles Hall, a 23-year-old Black man. Hall was experiencing a mental health crisis in the moments before his death, and his family, like so many others, had called the police because they were scared and needed help and had no other option. And that meant that help came in the form of armed police officers who, again, and I say this in a national moment where we have had to say this far too many times, and I do not want to be saying this again. But police, instead of de-escalating the situation, quickly resorted to gunning down Miles Hall in the street outside his home. Hall's story, as you know well, is not unique. In California, across the country, in every state, we have seen countless incidents of people in crisis being killed by police officers. And I should note that this is not the only context in which we have been dealing with police killings. My God, we have been dealing with police killings in every possible context. Today, we are talking about people in crisis. But I do not want to make it seem as though that is the only context in which we are having this conversation as a nation. But focusing for a moment on people who are in crisis, experiencing a mental health crisis. Police are poorly equipped and in many cases incapable of providing the necessary help. And in the face of these all too common police killings, advocates nationwide are demanding a new approach for these situations, a new approach to allow families to call for help on mental health in a way that does not involve the risk of armed law enforcement. Now, in California, Assemblymember Rebecca Bauer-Cahan is working to create a statewide alternative to 911 that could be used specifically for people in need of mental health situation help. Bauer-Cahan has introduced legislation that would establish a 988 number. It would connect callers with trained counselors and dispatch a mobile crisis support team staffed with mental health professionals instead of armed police officers. Now, Assemblymember Bauer-Cahan's proposal is part of a growing movement in jurisdictions across the country to do something about this, to divert mental health crisis response away from police and toward specialists or civilian specialists who are better equipped to handle these sorts of scenarios. Supporters of these alternatives say that by dispatching the best people for the job to mental health calls, they can ensure better outcomes for people in crisis, safer outcomes for people in crisis, and also free up police officers to concentrate on real public safety issues that they are perhaps better situated to deal with. Now, joining me now to talk about 988 legislation is California Assemblymember Rebecca Bauer-Cahan herself. Thank you so much for being here today.
Thanks for having me, Emily, and thanks for highlighting Miles. It's an important story for us to tell.
So can we talk about Miles for a second? I'd love to have an update on his family, on the response to his killing. I know they've been involved in local advocacy efforts and wanting to improve responses on just this type of issue. But I'm hoping you could talk about the role that Miles Hall's legacy has had in advancing this issue.
Yeah, Miles, his mother, Tawn, who I've gotten to know very well, I have to say, as a mother myself, losing your child is every mother's nightmare. Right. And we can't bring him back. But she has really focused her energy in the wake of his death on how she can make it better for other people who are suffering. And that is one of the most inspirational things that I can ever imagine or ever see. And it has been an honor to be her partner and the family's partner in moving this legislation forward, in remembering Miles, in talking about how in other individuals who are suffering in mental health crisis, we can respond differently. We can do better.
I'd love to turn for a second to the actual police department involved here, the Walnut Creek Police. I know they've committed to changing their approach to mental health calls, but it sort of seems like all of the different changes being proposed by police are different things that armed police can do, as opposed to maybe not responding with armed police. And I'm wondering if you can talk about how keeping armed police in the equation comes up short here.
Yeah, well, and I want to say that Walnut Creek has come on in support of the 988 legislation. They are a partner in this. We're working with Contra Costa County because this effort is both at the state level of setting up this phone number, ensuring we have the ability to get people access to these mental health crisis response teams, but it really is going to be partnerships with the counties that'll ensure that we get people to respond in those moments of crisis, like we saw with Miles Hall. So this is a local and state initiative, and we are doing it with our local cities. But to your point, we need to change the dynamic, right? I mean, 25% of all individuals since 2015 who've been involved in officer-involved shootings have been in mental health crisis. That is a shocking number, and we need to make sure that we are not responding to those people with a law enforcement response, but instead with a healthcare response. This is a healthcare crisis. And so that's really the goal of this legislation, is to ensure that there is clear, direct access into mental health response instead of into a public safety response, because that's not what we need in most of these, the vast majority of these situations.
Isn't that weird, right? Like if your heart stops working and you call 911, you get medical professionals. And if your brain is not working super well at that moment, you get someone who might kill you. It's just, it's a very strange, as you point out, like when you put it in the context of a medical response, our current system seems very weird. But that, it brings me to my next question, which is, if I were panicking, 911 has been drilled into me since I was like, since I was 1 year old. 911 is the number that you call. So I'd love for you to tell me more about the 988 legislation. I do understand that 988, if you are a panicky person like me and you call 911 because you can't remember any other number, it can reroute you to 988. But like, what are the other sort of functional parts of this process that people should know about?
Yeah, so one of the things is we will need, I mean, this is really important because once these phone numbers get set up, hopefully across the country, this is California's effort, but like you said, this is happening in states across the nation. And it was the federal government that authorized us, you know, they control the phone lines, that authorized us to make these moves. And I want to give them credit for enabling us to set up these incredible resources for our communities. But 911 is really easy, as you say. We remember it, we can teach it to our young children, we know how to use it, and we need a similar thing for mental health crisis. You know, these are moments when people are in crisis, when they just need help. And, you know, we have a 10-digit number right now that nobody is going to easily access or remember. And so 988 is easy and accessible, but it'll take some education, right, to drill that into our community in the way 911 has. But in the meantime, to your point, the bill does ensure that any calls that go into 911 that are focused on mental health will get routed to 988 to ensure a mental health response. Similar to what, you know, you pointed out, if I call 911 with a fire, it gets routed to the fire department. If I call with a medical emergency, it gets routed to the ambulance service. So similarly here, we will have it routed so that you will get these mental health response teams or mental health services on the phone if that's sufficient.
So where does it stand right now? I mean, what sorts of conversations are you having around it? How confident do you feel that it'll pass? What's the timeline? Like when can people start calling 988?
Well, it'll take a couple of, I mean, we will have to set up, there's an infrastructure behind all of this that nobody sees, right? So we're setting up call centers. We've got to work with the counties to set up these crisis response teams. So it will take time. There's implementation that will come into effect after the passage of the bill. Although we are working to get an urgency clause, which means the law becomes effective immediately, so we can get to work right away on setting up that infrastructure and getting this into place for Californians as soon as possible. But there is, like I said, there's a lot to do to make sure this is a seamless process that works for our communities, that gets them the response they need. We are failing them right now. I think that's what stories like Miles Hall tells us, is that we're failing those that are in crisis. I mean, it is incredible. You know, a third of people who are homeless are in mental health crisis. The LA County Jail is the largest provider of mental health services in the nation, right? The system's broken and we need to recreate it, and that will take time, but we are working hard and we're getting there. We have an incredible set of support from the mental health community to our counties. Many of our counties have come on in support of this legislation. As you know, many counties are trying to do this on their own right now, so they're excited to have state support to make it happen in a really seamless way. We have partners across the spectrum that are working with us to get this done. So I'm optimistic that we're going to do this because it's past time that we have the solution for Californians.
Okay, so this may be a dumb question, but like, does anyone oppose this?
Well, yes. I won't say nobody. So there is, so many people probably know that you pay a 911 fee on your cell phone bill or on your phone bill if you have an old landline. So this actually has a similar fee. and it will be the 988 fee, and it will pay for these phone lines, which I think is really critical. That is a little bit controversial with some the telecommunications industry, but we are in conversations with them. We're going to get there. They are supportive in concept, and they know this is coming. And so the question is, how do we put that fee into place in a way that works for Californians and creates the system that is so needed?
So I'm going to ask you a math question now. I hate it when people ask me math questions on the spot, so I'm going to do it to you just because
we're both attorneys. I
know we can't do math. So studies of 911 call volume from large cities suggest that somewhere between 30 and 70% of police calls for service could be handled without an armed police officer. They could be addressed effectively by community responders or an administrative response that doesn't require police. And so when you talk about like this additional fee for the phone lines, I'm kind of wondering if, as this scales up non-police response, are there any cost savings to be realized in police budgets? And do you have a sense of like how many calls California police are currently handling that might not require an armed police officer?
Yeah, I mean, I think the best way to answer that is actually looking at the Eugene, Oregon program. So they have piloted this up in Eugene, Oregon, and annually, just in Eugene, Oregon, which compared to the state of California is tiny, right? They're saving $8.5 million a year by doing this, right? So there's incredible savings. If you look at the cost of taking someone to the emergency room, right? So most of these calls, one ends up incarcerated or in an emergency room because of who's responding to these calls. It costs us less to respond with these mental health crisis teams and actually get you mental health care than it does to respond in the way we currently are. So there's a lot of savings in the system. You know, I think it's somewhere around 15% of police resources are going to these calls that we are trying to divert. So there are resources in the system that we will be able to redivert, but the setup cost of this kind of phone system and these call centers is significant, and we do need to invest in it. So I think it's critical.
So when I think about what's happening, you mentioned the sort of local county level. I'm thinking of macro in Alameda County, sort of imitating the Cahoots model that you just referenced in Eugene, Oregon, and maybe STAR in Denver. But I'm wondering, macro is trying to go, I think, a little bit farther beyond mental health into sort of more low-level things that don't need a police officer. It's sort of a broader category of just like the little stuff that just needs conflict resolution or a level head or, you know, a good listener. So I'm wondering, do you see a next step where civilians could handle a portion of emergency response calls that police are currently responding to beyond mental health?
Yeah, I mean, I think another great example, and I love looking at our local communities that are stepping up and doing all of these things. And part of what our role is, the state and the federal level, is to take those things that are working like Cahoots and spread them to other communities. And in my own county here in Contra Costa, one of the things they've done is set up these homeless response teams that are with the homeless every week. They go out, they provide food, they provide care, they know the individuals that are living unhoused right now, and it's working, right? Whereas police used to respond to those situations, they now have teams that are in relationship with our unhoused community that are responding without law enforcement, right? And it's those kind of programs that are game changing, that are taking things out of the law enforcement system where it's not really a public safety risk, where we don't need a law enforcement response, that, to your point, frees up law enforcement for when there is a public safety need. It also gets us better outcomes, right? I mean, you can look at, you didn't mention, but the Dallas program, right? Dallas, Texas is doing this kind of program, and they've diverted 900 people from the emergency departments and 500 people from jail in just the short amount of time they've been doing this program, right? So the more that we get this out of the criminal justice system, the better the outcomes and the more people we were taking out of these costly systems that are unjust and result in this cycle of incarceration.
So I'm just wondering if you could talk with me for a second about the Crises Act that I think Assemblymember Kamlager had brought to broaden the pie here and scale up these alternatives. What's your take on that? Is that happening kind of in parallel with 988? Is it the next step? What can voters expect? Yeah,
so I'm a co-author of now Senator Kamlager's Crisis Act. I think it's a great...
I apologize. I meant Senator Kamlager, and that's the second time I've made that mistake tonight. So my apologies to Senator Kamlager. I'm never making that mistake again.
Takes some getting used to, and we very much miss her already on the green carpet. So yes, it's an incredible effort that, as you mentioned, was started last year and didn't make it to the finish line, although had incredible support, to build up these local resources and local responses for non-police response where we need it, and many in this mental health context. And so I see this as very much partner efforts, right? This phone line is really critical to give people access into the system. We want it to be as easy as possible for people to know how to get the support they need, right? Call 988 and we'll find you the mental health care you need. And if that's an immediate mobile crisis response team, we'll get you that. We'll get you what you need. And we don't want people like Miles Hall's mom searching for help and failing to get the help that Miles needed. We want it to be easy and accessible. And then underneath that, there needs to be an incredible infrastructure of care, right? We need the beds to house people who really need support. We need, we need social workers who can support these people day in and day out. We don't have enough of them on the county level, right? So that is where Senator Kamlager's effort really comes in providing our local communities these built-in networks that already exist with the resources they need to scale up and provide the response and the care that this 988 will hopefully open up to so many people.
So let's talk about federal support, because I know there's an effort in Congress right now to create a new program at the Department of Health and Human Services that would provide somewhere between $500 million and $1 billion per year to support these new types of programs. In the same way that DOJ used to fund traditional law enforcement efforts, we're now seeing support for alternatives to law enforcement. How important is that federal support to the ability of cities and counties and states to expand these programs? And are you talking with any, of California's congressional delegation and others about how to nab some of that funding?
Absolutely. I mean, federal support is always helpful. I'm not going to lie. They have incredible resources, and the more they can come in and really, and they do every day, right? Many of the resources that come into our counties for these programs come from the federal government, and the more they can do that, the better. I will say that we as a state don't wait for them, right? I mean, that's really critical to California always leading the way, is that we want their support. We need their support, but we're going to move forward anyways, right? We're going to make sure that we're getting our constituents the care they need, the mental health services. But the more support we get from the federal government, the more we can do, and the deeper that level of care can be. And so we absolutely are working with our local congressional representatives and Washington to ensure that, again, we are moving this in the direction that America and California and all of us want to go, which is healthcare and mental health care deserves to be in a healthcare system and not in the criminal justice system. Let's take it out. Let's get the resources to provide the care that has been lacking in so many instances. I mean, just the other day, I was talking to Angelo Quinto's family. I don't know if you've had the opportunity to speak to them or hear his story, but another young man struggling with mental health crisis here in our county who didn't get the care he needed and ended up dying at the hands of law enforcement. And we have to stop this. We have to get them the care they need long before the day they die and ensure that they're living he had such opportunity. Here was a veteran who was full of life and could have lived this incredible life, and it's over. And that's a failure. And we need to change that, and we need to do it now. And the federal government will hopefully step up and support us in doing it, but we're going to move full steam ahead either way.
I appreciate the commitment to moving, because it has felt now for years before 2019, before the pandemic, but I think in a very enhanced way as we all dealt with the pandemic, and also with the sort of ceaseless epidemic of police violence. It has felt like talking about this and telling these stories and saying these names is just not getting through. So to have an elected official acknowledge the urgency with which change needs to happen is really encouraging. And so I'm going to ask you a question based on that. You said that California needs to be doing it anyway, whether you get federal funding or not, making the change, leading the nation. Obviously, as you mentioned, we're seeing really exciting momentum for change across the country. I guess I've gotten kind of cynical in that, I want to see it to believe it. But I'm wondering, as you push forward on this, do you have advice or things you've learned that you can share with other legislators, be they state or local across the country, who want to act now and with great urgency on this? What would you tell them? What would you tell them to help them move on this?
I think it's listen to what our communities want, right? I mean, we saw that in a way this summer that we haven't seen in a long time. People taking to the streets and demanding change, right? Like you just said. And it is our job to step up and make that change happen. That is what I was elected to do, right? And as I have, the opportunity to get to know these families that have suffered the ultimate loss, it's, waiting one day or 1 year longer is too long. One life lost is too many, and we've lost a lot more than that, as we all know. And so, just stay strong. And here I am carrying a bill with this fee that, that's the challenging part of this bill. I don't think anybody philosophically disagrees with the effort, but it's always, how do we fund it, right? And are people willing to support this funding mechanism? And I'm not going to stop until we get people to step up and say, no, this is what matters, and we're going to fund it, and we are going to save money on the back end, and that will support the underlying needs. And, there's a way to do this, and we're going to do it. And this bill already has bipartisan support. We have Republicans signing on as co-authors. We're not doing it alone as Democrats, because together we can push forward and believe that our community deserves so much better than what they're getting today in every way when it comes to mental health crisis response and mental health services. And that's the effort that we need to do. And you started by really talking about how this is one very small piece of the puzzle, and it really, really is. And I think that's critical, both the mental health response piece to the crisis that we are trying to solve here with violence with police violence, but also with mental health crisis, right? This phone number is a huge step in the right direction to accessing services. But as you talked about Senator Kamlager's efforts and the federal government's funding, there is so much more we need to do. And we all have to come together to solve it. And we all have to be willing to make the change that our communities are demanding. And so I think it's every single person that has stood up and demanded this change. It is every family brave enough to tell their story. Every time I hear Tawn talk about her son, I think how incredibly brave she is, and how it is a gift to him that she's willing to do it to make change for other people. But that's hard. That is hard, and she shouldn't have to do it, but she does. And so thank you to everyone who has been an advocate for this, because it empowers us to make the change and to make it as quickly as we can. And that is what my team and I and everyone in the legislature in California who's stepping up to partner with me on this is committed to doing.
Well, Assemblymember, I know a closing argument when I hear one, and I think I just heard you give a very powerful closing argument. Thank you also for highlighting the work of advocates and those who have lost so many. Thank you for crediting Black and Brown communities with leading the way on this, and thank you for your work in pushing this forward. I wish you the best of luck.
Thank you so much. And thank you to everyone, to you, to highlighting this important work. And like you said, to all the Black and Brown communities that are in partnership with all the leaders who were working hard to do what needs to be done today and not tomorrow. Thank you.
Take care. Thank you so much. So there you have it. 988 might be the new number that you need to know. If someone you know is experiencing a mental health crisis, it's a health crisis. Just like if they were having a heart attack or broke a leg. This is part of the body. This is a piece of healthcare. This is not something for which people should ever be requiring armed police officers. And here we are having another conversation about California perhaps pushing our nation a little bit farther ahead with statewide legislation to create a 988 system that would create a new number, sending a mental health crisis response team to the scenes of, you got it, mental health crises. I appreciate the opportunity to cover this initiative and initiatives across the country that are moving along the same tack, which is to take vulnerable communities that have experienced so much harm from police, out of contact with the police. And as the Assemblymember mentioned, this is one small way of doing that. This is not the whole pie. This is not the whole picture. But each small way that chips away at the risk police are currently posing to Black and Brown people in America is a step in the right direction. So thanks so much for joining us here on the Appeal Live to talk about it. I'm Emily Galvan Almanza. We look forward to seeing you again soon.